even if you're not paying for it yourself, just knowing that actually this person's an expert or can deal with the condition that I know I'm going to see him for or her is it's so powerful. And I think that's what we want to try and solve.
Hello, Protrusive. I'm Jazz Galati, and welcome to this group function where we answer a really big and important question I get quite a lot from our colleagues. Now, you guys know that I've been using something called Doctify to collect reviews, but the number one objection or query I get from dentists is that, hey, Jazz, use Doctify, but my principal is being really funny about me collecting my own reviews. How did you overcome this? Or something related to the fact that there's some sort of friction between principals and associates. Like even if you collect Google reviews, as an associate, when you are doing all the hard work to gain the Google reviews, to uplift the goodwill and the reputation of the practice, but what if you leave that practice? Those reviews don't go with you. So we asked Dr. Suman, who is actually an orthopedic surgeon, who actually created Doctify to answer this very important question, as well as how to harness the power of dental reviews. So even if you don't use Doctify, you will gain something about how to use reviews in a clever way, how to collect more reviews, and how to actually improve the social proof of your practice. Hope you enjoyed this group function. Part of this podcast is journeys, learning what motivates people, learning about the different routes people take. So Shimon, do you practice clinical dentistry at the moment?
No. So my background is, I'm not a dentist, so I'm going to put it out there now. I'm not a dentist.
I totally thought you were. I totally thought you were. That's
yeah. So it's been super interesting learning. I've been in and around dentistry for 3-4 years now. And I've got a lot of dental friends. So I'm an orthopedic surgeon by background. So I trained in London. So I was an orthopedic registrar when we founded Doctify. And then I guess we've been in dentistry because we started in healthcare and medicine and surgery because that's what I knew. But we suddenly went onto our site, and I think the third most searched thing was dentistry. Even though we had no dentists, we weren't working with dentists about 4 years ago. And so we basically just knew one of the things people, not even patients, just people care about is finding a good dentist. How do they find a good dentist? And then that's why we kind of started the journey on the dentistry on.
Okay, well, let's roll back the years a little bit. Your position as an orthopedic surgeon. Now, are you still practicing medicine now and surgery now?
I've been a very long sabbatical, so it's been a few years now. So I guess I trained in London. So myself and Stephanie, my co-founder, both orthopedic surgeons. We started the company around 5.5 years ago. And then we've been full-time for at least 3 years now, I think. I think there's something which is probably quite interesting to your listeners. There's something called the NHS Clinical Entrepreneur Scheme, which is really looking for basically forward-thinking health professionals, dentists, physios, doctors, surgeons, whoever it may be. And it allows you to basically work in innovation whilst maintaining some clinical practice. Or taking time out, actually protecting your training, taking time out so that you can work in innovation.
And that's what you took the advantage of, right?
Yeah, so I did. So I was doing both things. It was a full-time job in orthopedics. We were both in the evenings. We were working on setting up Doctify many years ago, and then it just didn't become sustainable. Like there was so much going on, and then so we applied for this NHS scheme, and I guess that was the first stepping stone of giving us a bit of bandwidth to actually work primarily on Doctify, try and really make this happen. And then the rest is history, I guess. And then it's kind of grown rapidly since then.
Amazing. And tell us about this move to the UAE. Like, just give us a little flavor of that.
So I guess, so the UK, so it was obviously our base, and we had really strong growth in the UK, so it was going well. And then I guess we realized healthcare is healthcare. Wherever you are in the world, there's an issue. Like, whether you're in UAE, Germany, US, everyone kind of wants to find good health professionals. It's one of the most anxious moments we go through. Unfortunately, ourselves, even as professionals, will go through it, family members will go through it. So we kind of realised that this is not a UK-centric problem. Often when you train and live and are born and brought up in the UK, it's the whole world. And then you suddenly realise, actually, you can really apply this elsewhere. So, and there's traditional healthcare links between UAE and the UK. There always have been. And so it was really like a natural testing ground for UAE. We're actually now, since we're launched in Germany, Austria as well, and soon probably 2 more markets by the end of the year. So, and then really, it's the same problem we're trying to solve. Like, it's the same thing, regardless of where you are in the world.
Amazing. And that is really cool. I really like your story about going for the NHS clinical sort of, I think it was called entrepreneurship scheme. That's really clever. And I think that's probably still available today for some people who may be looking for that kind of stuff.
100%. And I know there was a big push in dentistry 2-3 years ago. So I really would encourage anyone with an idea It's like a nice, soft, like no commitment stepping stone. Like if you're, a practicing dentist and you've always had ideas and you're into innovation, it's a really great scheme to just join up to. You basically become part of a community.
Funnily enough, I actually went to this. I actually went to like an open day for this, like a little meeting with some doctors there. I was there regarding this scheme actually, and I just decided that I just love. At that time, I was still developing as a dentist, and I had so much to learn. I was just so much to learn. I was like, I can't step away from my clinical commitments just yet. So that's why I didn't go, full bolt into that. But I appreciate what you've done is that you've actually saw that okay, there's a big problem beyond just the small number of patients you can help. You can actually help the bigger picture here. So I really respect the fact that you made that very bold decision to do what you're doing now, which is amazing. Do you miss the practice of medicine?
I miss it a lot. I joke it's that it would always be less stressful to do a clinic now, to sit down and see patients. I miss that interaction. But I guess it's like you said, the idea is that I do think that we can help people on a wider scale. Instead of tens of thousands, you can help millions potentially.
Well, the one thing I want to talk about is the power of reviews. And I guess I appreciated this around about 4 years ago myself. Obviously, reviews are a huge thing now. Even 4 years ago, they're big, but the reviews some years ago is more something that you associate with like, TripAdvisor, going to restaurants and finding out where to eat, right? And then when I had a appointment coming up with an ENT surgeon about my nose, and there was a few issues going on, previous cricket injuries and stuff. Always seem to get injured playing cricket. And the first thing I did is I Googled the name of this ENT surgeon before I was going to see him privately. And I was really encouraged to see all these positive reviews and stuff. And I almost felt as though I knew him, the guy, before I got there for my consultation. And that's when I appreciated, hey, if I'm Googling this orthopedic surgeon, then dentistry being the second most intimate, part of the body, surely patients who are very anxious are Googling us as dentists. Yeah. And I think that's happening more and more and more now. Is that, do you think, what the trend is now? And was that the sort of rationale behind creating Doctify and going into dentistry?
Absolutely. So I think it's, it was a personal experience. So I guess I've told this backstory many times, but it was Stephanie was looking for a dermatologist. We were friends, we trained together. And she had a problem. She was looking for a dermatologist and she couldn't find one. She went onto Google and basically ending up seeing someone, paying a lot of money. She saw them privately and didn't have a great experience. And actually that person was not as, I guess, had the expertise to deal with the problem she had, but she had no idea. And it kind of just, when clinicians can't find other good clinicians, even though they're in the sector, you just suddenly think how lost the patient is or what sort of decisions they're making for themselves. And I think, it's weird to think about it, but Google didn't exist, 10 years ago, 15 years ago. It wasn't a thing. Now it's just so natural to pick up your phone. And even if you're going to see an NHS dentist or doctor or surgeon, you kind of still Google their name just to see. And I think if you can get good information back and trusted information, that changes that interaction you have with that clinician. Even if you're not paying for it yourself, just knowing that actually this person's an expert or can deal with the condition that I know I'm going to see him for or her is it's so powerful. And I think that's what we want to try and solve.
So I think we appreciate now in dentistry the value of reviews. And I think it's growing more and more. The trends on Instagram is that as soon as people put a Google review, people then share it on Instagram and whatnot. So I can totally see why Doctify has its role. So a couple of questions I have. I'm going to challenge you, Suman. I'm going to really put you on the spot here is, why bother with Doctify when you have Google reviews? Okay, that's the first probably objection you might get. And then I'll tell you my second one shortly. So this answer, I think I know why you have it, but I want to hear it from you.
I'll go back a bit. I think so. Just to clarify, like what you mentioned, in every sector you read reviews now. Every sector. And whether you're buying a bed or whether going on holiday or going to a restaurant. So, and I think the most important thing around reviews now is the quality and the trust. So reviews have now become a thing, but I think you'll see a lot of stuff around now is, are they verified? Are they trusted? Did that person actually go see that? Use that service. Let's call it that, for example.
Like fake Amazon reviews are a big thing now.
It's everywhere. It's everywhere, and they're all doing things to combat that. And I think that's because there were lots of open review services. Which is, I think, still a good thing because it's been proven that still lots of them that are true and verified. But there's two things that happen. So Google reviews you mentioned is it captures the extremes. So I know we did a survey of hundreds of providers and clinics and hospitals around the world, And these are hospitals that have seen 10,000 patients, 100,000 patients. How many Google reviews do you think they had?
Hardly any, and they're probably like the odd 5-star and then loads of 1-stars, because that's people will just want to. People obviously when they have a negative experience, they want to tell more people, right?
Absolutely, 50. It was like 50 to 100, and I almost found that sad. So basically, you get the really ecstatic people, which they really want to tell their story, and then you have the really unhappy people who then go, "Well, I really want to vent." And I guess what I find quite sad is, like, you're a practicing clinician now. You have most of your patients are very happy. You're going to see loads of happy patients every single day, but you're just not capturing it. People, and that's whether you're a huge hospital or big, thriving dental practice, or just an associate within a practice. You're seeing patients every day. And I guess we know that there's amazing healthcare being delivered, but it's not being captured. So I guess, how do we capture it regularly so it represents you? And then I guess the one elephant in the room is things go wrong. This is healthcare. Things are going to go wrong in dentistry, medicine, whatever.
Absolutely.
And you just have to accept that. And I think what we're trying to do is say, well, if you have a bad review, that's not a bad thing. In fact, how you reply to that is so powerful, because it tells you more about me as you as a clinician to me. Like, if you apply and go, you know what, I'm really sorry this happened, this is how I'm going to fix it. I'm going to go see you now. Like, I'm going to be like that. When things go wrong, you look after me. But that only works if you're capturing reviews across the board. It doesn't work if you're capturing outliers, because then you've got like 3 bad reviews, 3 good reviews. And is that really representing your care? You and I would both argue it's not.
Well said. And I think it's great you mentioned the fact that, to draw a parallel to like the restaurant industry, I actually like those restaurants where you go and then you have the odd bad review, but then how the restaurant or the manager responded to that just shows how much they care. It's the same in healthcare, like, how you respond really does show about your values. But then your point really leads nicely to my next question, which is you don't want just all the outliers. You want to capture as much as possible. But here is my, I'm a happy Doctify user, and I think patients do come in quoting the fact that, hey, I read your reviews. Now, I don't have a Google review page, so it must have been my Doctify reviews, or the fact when I've embedded my Doctify reviews on my personal website. And I was speaking to Alex, and he says that my Doctify page gets over 600 reviews a month, which was like, wow, I didn't know it had that sort of exposure. And I'm quite an open book. I mean, I'm out there on YouTube, TikTok, etc. But I'm quite impressed that when you Google my name, my Doctify's up there, like right number 1, number 2, something like that, which is pretty awesome. But here's my beef with Doctify, and I'm going to just keep it very open, honest with you, but I'm going to give you an opportunity to just reply to me. My beef is this, is that I think is better than just Google reviews because of everyone who's been bit by a fake review or a negative review, or a competitor down the street writing giving you a 0-star. That's a terrible thing. So I think what Doctify gives you is verified, right? You could only someone who's actually definitely been a patient of yours can leave a Doctify review. That's correct, right?
Yeah.
But my worry is that when I read Doctify reviews online of other dentists, I feel like they're too skewed towards positive. There's like, I've got 44 5-star reviews. When I get someone who's not the happiest, I'm less likely to give them my link to lead them the review. So do we have a problem here in being able to compare dentists? Because if everyone's got like 100% 5-star, there is a problem in that. How can we combat that?
Yeah, so good, really good question. And okay, I'm going to take it in 2 parts. So one, now you're more confident, as we've just discussed it, that actually replying to a negative review is a good thing. So Jazz, you're going to be way more confident, and that unhappy patient, you're going to get feedback from, you're going to reply, and that's what I want to get people. I guess that's our goal and our vision of where we want to get people to. And I guess it's automating reviews. So we build software, really. So we see Doctify as a publishing platform. It's not about generating patients. It's about where we publish the feedback, and we basically give you software, whether that's tablets, verified review links. We work with like the big providers, so we can automate it from SOE or R4, whatever it may be, and we can literally automate a link to every patient that goes into a dental practice for any dentist, and we do that with our big the chains we work with and stuff. So that kind of combats that. Now you're absolutely right. There is still a reluctance to be like, that patient's not happy. Let's try not to get them to leave a review. It's I'll be honest. 5 years ago, no one would even let me leave them a positive review. I couldn't even get a clinician to say, please review me. So I think it's like this path we're on to get them there, and I can now go on and I'll show you like 10, 20, hundreds of negative reviews with dentists and doctors replying. And they would never have done that 5 years ago. They'd have been scared. They'd been on my whole... But the reason they're more confident is those clinicians are asking every patient to leave feedback. They're getting good representative feedback, and it becomes less scary. It becomes way less scary. But you're right, and I think I want to try and, I guess, fill them with confidence that they're going to get good reviews. And I do lots of talks on this. And it's in Uber, there's a big difference between a 2.8 Uber driver and a 4.0 Uber driver. You almost can be like, something's going on there with a 2.8 Uber driver. In healthcare, actually, we're all highly trained professionals. I like to think that most people have, really, even if they're having a bad day, they're providing a very good service on a daily basis. And there's actually a big difference between 4.4 and 4.8. And we've got all this data and we've seen it. And I guess that's the thing we're trying to show people, is that there's amazing healthcare. And then almost if you're creeping into 4.4, 4.3, well, let's look into it. Let's look into the reviews. Let's look into feedback. Let's analyze it. And that's where, I guess, where we sit now is, let's make it representative and represent the industry as it should be. There's amazing care, like particularly through COVID, I know, like super stressful. There was amazing care being delivered. It pains me that I go online and that's not represented in dentistry. It's still not representative. And then let's learn from it. So we built like an analytics tool. You can basically learn like, what are your patients saying about you? So I know, for example, we work with one chain and we analysed their reviews for COVID, like how do they perform during COVID? And you don't think patients will be like, oh, it wasn't COVID safe, it wasn't this. They mention COVID a lot, but most patients mentioned it in a positive way. They made the point of saying, I felt safe and COVID safe. So despite COVID, I went into this clinic and I felt really safe. And that was such a good learning point for the chain to be like, you know what, we've ticked a box, we're actually doing something well. And just things like that. And we've had hospitals change their reception team because they go, we love the clinicians, but receptionist was a bit moody. And it was literally like the same thing happening over and over again. And because they weren't collecting feedback on a daily basis, they never knew. They kind of maybe suspected things. So our aim is actually to take this review data, and this is where I guess we're different to Google reviews. And I want to feed it back to you as a clinician and be like, this is what I'm doing really well. This is maybe what I need to work on, or actually just keep it up. That's kind of what we're trying to do now.
Well, one of the arms of clinical governance is to actually get that data from patient satisfaction. And if you're able to give them a link to Doctify to leave a review, for example, that's a verified patient, then you can collect so much data and that can form as part of a portfolio for, hey, what are we doing good? What can we do better? So I definitely appreciate that. I'm going to pitch you another scenario now. I'm going to make it very tangible for you and relate it to medicine maybe. Imagine you have an orthopedic surgeon who works in a couple of different chains, or let's say 3 different chains in the private sector, 3 different private hospitals, and so he has 3 different contracts. That orthopedic surgeon, when I searched for that ENT surgeon I told you about, I wanted to know about him. I didn't care about the hospital as much as I cared about him and the care he was going to give me, right? The big problem that because obviously I've talked about Doctify a lot on the podcast before, something I've been very open and honest about. I like it. I have it on my website, and people ask me a lot about Doctify. And the biggest barrier I'm getting, or the biggest issue I'm having, the friction I'm having, is principals and associates.
Yeah.
So in the same way, the associate may move clinic one day, and they want their reviews to go with them because it represents them as a clinician.
Yeah.
Equally, the clinician is working under the premise of the practice, and the practice wants to generate reviews. So there is a real friction there. Any thoughts as to how best to have a win-win and create a diplomatic scenario here?
So maybe I'm an idealist, but it's a very happy, you scratch my back, I scratch yours relationship. It's a harmonious relationship. And that, yes, they may break up at some point, but the truth is the practice is benefiting from the associate working there, seeing patients, doing a good job, and generating, revenues. Let's be honest, like from there, and that's great. And then the associate as well is bringing work in. If they do a good job, they bring work in, and it's like the two don't work without each other. So if it's like I find it difficult when there's, and maybe as a clinician, there's this power play, and it happens in medicine as well. So the same scenario, a consultant works in 3 different hospitals, and I guess they're a bit further down where they're basically like, we're going to use this consultant to generate, as someone who works here with a good reputation and generate pay. If he moves on, that's fine. But whilst he's with us, we're going to use that. And I guess I'm trying to get principals to that point, because I see it as, you've got to have a good working environment, a good team. You've got to make them feel empowered. You've got a new associate joins the practice. No one wants to see the associate. Why? Because they want to see the principal. I'm sure it's a very common thing, because they're the experienced person. She's been doing it for 20 years. You're new. So I actually say to them, look, why don't you validate them? Give them a colleague, so we have colleague recommendations. So I've trained this associate, they're really good, and I recommend them for these procedures. Like I get feedback for that associate. Now, the argument then is, well, I've built up this associate, great, now they leave. My argument then is, well, you've used that associate to work for you as an employer, who's worked for you, like, given their time, worked hard. They kind of, it's almost a bit maybe vindictive to be like, well, now I've built you up, I don't want you to be successful elsewhere. I would hope that there's this kind of happy roundabout where we're all in it together. We're all looking after patients ultimately. I know this is a bit idealistic, but that's how I see it. That's, I don't think there's ever going to be a perfect scenario, but the way we say it is ultimately the reviews for the person are the person's reviews. Reviews the practice of the person's for the practice. Because you've got to, ultimately that's the person's identity and their their expertise.
I agree with you totally, and it's just there is an element of toxicity around the atmosphere in the UK dentistry at the moment for sure, whereby there is this friction. I do feel way more associates would have something like Doctify if there wasn't this friction or this difficult conversation with the practice. And I think what you're saying is very idealist and it should be the way forward. But I can understand from the principal side as well that they want to collect reviews for the practice because it's their baby, it's their investment, and they want to grow the practice rather than disassociate.
So can I answer to counter that? What if an associate chose to collect reviews themselves, a principal can't really stop them, or can they? Is that, or were you saying actually they could stop them?
Put it this way: you're self-employed, so really, you can't.
So my argument is that they're trying to improve their practice. They want to understand what their patients. They're new to the bit, to dentistry, like in terms of practice. I would always want to encourage associates to do it. And then I would say to the principal, look, you've got a really good associate on your hands who patients are loving. Use them to build your practice, your thing. And it's like, if you're really smart, and to be honest, we work like with few chains where all the associates are on, all the dentists are on, and it is working really well for them. Yes, one day they may move on, but to be honest, during that period, you've really, really built your practice. You've got a patient who's walked through the door. Now, some may follow an associate, you're right, potentially, but some will also be like, actually, I've been in this practice for 5 years, and I like that, and that's the way, that's life, I guess.
I think it's the difference between having a growth mindset and appreciating that you're doing everything to build everyone up and grow, and then there's a fixed mindset. So I think there's the principal who's very much against their associates collecting reviews has that very narrow fixed mindset, whereas the principals are like, yeah, let's go for it. You're going to bring more business in, has a growth mindset. So I think there's definitely a mindset issue there, and I think you're right. A principal can't stop there legally. I don't think their associate collecting reviews. It just creates potentially some friction. So I'll tell you how I do it, Suman, because I want to keep my principal sweet. And I do notice that, I've got more reviews on my Doctify than one of my practices has on their entire Google reviews, right? And I don't have that many still. I could be doing better. And that's the next question I'm going to ask you, is just lack of time and stuff. But yeah, I know you guys make it easy, so we'll discuss that. But one thing I've started to do now is, for every one review that I collect from my Doctify, I'll make sure that the next patient, I'll get one for the practice who uses Google reviews or who may use Doctify or whatever, right? So that is for now a happy ground. It's not a conversation I've had with my principals. It's just me out of respect doing that, because I think there's plenty of reviews to go around. So you keep everyone sweet.
Yeah, and just on that, I guess we've built it, because it's a good point you've made, is that we can actually, with your review link, you can actually collect reviews for the practice. We could actually set up your practice so that every time you collect feedback, so does your practice, and vice versa. And that's what I'm trying to do, and create this harmonious balance. Is depending on the scenario, a patient does go, oh, this is the dentist and this is the practice, and I want both to be almost tick the box on both. This is it's the same with medicine. Now some may go, oh, it's practice first because I like the big shiny practice, then I'm going to choose who I see. Or some may go, well, actually, I just want a really good dentist and I'm less concerned about the practice. But generally, they will almost sanity check both. So even to your point, I would be like, let's get your practice set up. Let's keep them happy, because I want to collect more and more. For us, we don't make money off patients. I literally just want to capture all these stories, like as many as we can in as high volume, and ultimately then validate good care, which I'm sure is happening.
Amazing. Perfect. So my final question is, what is your recommended advice to dentists to help them have those conversations about collecting reviews. A lot of dentists are shy. A lot of dentists are introverts, and they don't want to get these video testimonials. They don't want to push this upon them. So there's actually a communication issue there. What advice can you give to dentists when it comes to collecting reviews and collecting feedback and testimonials?
Yeah. So I guess the simplest one, let's say they're completely independent. They don't have access to the practice software, or they can't collect them via the practice, let's say, for argument's sake. So one thing is you just, after you've treated the patient, typically even at the end of a treatment plan, so you've discharged them, you've done everything, it's just to be like, I loved some feedback on your care, and you send them a little link. And it's a template email, and our team are very good at kind of making them feel engaged. And you're doing two things. You're showing them that you actually care about your practice and improving and becoming a better dentist. And you're also checking in on them and saying, are you doing okay post-care? How are things? Email me back if there's anything you want to discuss. So that whole thing around negative reviews, again, comes now, is that you will have less negative Google reviews as a practice or as a dentist if you start taking these steps. If at the end of a treatment plan, you take the time to just say, how are you? Anything go wrong? Are things great? They're going to directly come to you. They're going to directly email you back and go, you know what? Things are great, or actually things are good, but there's this one concern I have. So you're instantly, reducing your complaints. You're reducing everything, your negative reviews. And that's really low touch. You can be an introvert and send an email. Super easy. And that's what I always suggest.
Very good, and it's something I do as well as ask them verbally and sometimes even video testimonials. Is there any data that we have to inform us as to what improves the success rate of collecting a review? For example, sometimes I'll ask a patient, hey, will you leave me a review? They'll say yes. I email the link and they don't leave a review because they just don't take that final step. Now, I imagine imagine the lowest rate of review collecting is you don't even ask the patient and you send them an email, right? And that's probably going to get a low percentage return because they weren't even expecting it. I think by asking or telling the patient, hey, I'm going to send you an email, that probably increases it. Now, is there anything else I could be doing to increase the acceptance rate?
Yeah. So, good question. So, I actually don't think you need to ask them. So actually, I think the industry has changed enough that they're almost expecting a little bit. I think it's great to ask them, but to your point, some people don't feel comfortable as clinicians. Then I would almost be like, it's not essential. Now, email, we all have email overload now. I mean, we all have our junk emails, our main email, another email. It's crazy. So emails has the lowest conversion of sending an email, getting a link and getting it back. Text message. Now, this is where you need your practice management system. A text link will have a much higher. You text their phone, they literally fill it out and it's done. We'll have the highest, and then we've got tablets that sit within the practice that obviously has where the receptionist can just say, "We'd love to get your feedback." We have these nice branded stands that sit in the practice. It's it's a bit it's almost like those smiley faces that you see. So we have those that sit in dental practice as well, and that obviously has, if done right, has a really high. Their practice is capturing 60-70%, but we've done I think we have probably one of the most reviewed dental chains in the country now, because they automated from their software a text message that just goes out after a treatment plan. So we literally have one of the most reviewed chains in the country, if not even regionally in Europe. I can tell you now, because again, back to Google, you're capturing 50, 100 reviews when you see thousands of patients. So the technology's moved on enough that there's a lot you can do.
That is a protrusive pearl right there, I think. That's amazing. So I think the take-home message there is, email is good, but we are getting email overload. Consider text messaging to increase your success rate of capturing a review, and even having a tablet in the practice, which I know you guys have been good at setting up the QR codes and stuff, which is very forward-thinking, and that's awesome. Shimon, you answered all my questions. I really appreciate all that. Is there anything else that you wanted to say?
Well, I guess there's two things. I think, because I'm super interested in your listeners, and also we're really open on feedback, particularly from the dental community. So I'd really encourage anyone who's got ideas or wants to push us, good and bad. I really love hearing it. Is number one. The second thing is I think there's one thing we're trying to do, and that's not. We talked about reviews, and they're quite specific, quite generic. My pet peeve is generic reviews. Oh, this is a 5-star dentist. This is a 5-star clinic. Great. I want actually meaningful reviews, and I think that's what we're trying to do. So, and this comes back to being recommended for a specific condition or procedure that you perform. So, and this comes back to general dentistry, to cosmetic, to specialist stuff, to endodontics, whatever it may be. So, I was talking to a friend the other day, and he was like, "There's same-day implants now. There's you can do, and you do 3D printing, and I'm not a dental expert, so I'm not going to say the right thing, but you can do same-day implant, and it's a new thing. It's cool tech." and imagine collecting 100 reviews for that specific procedure. And that's what we want to get to. And that's whether you're an associate or principal or for Invisalign or for whatever it may be. And, you treat gum disease and you're one of the best perio people in the country. I want you to be recommended for that specific thing. So as a patient, I could be anywhere in the world and I can go, I have had this real big problem with, let's say, gum disease. I've seen 5 specialists, it hasn't worked. I now want to find the world's expert. And our plan is to go on, you can go on Doctify and you can find someone who's got recommendations from colleagues, 1,000 reviews for gum disease, and that's the person you can go see now. And that's I guess what I want to encourage the dentistry industry to go to. I'm always open to ideas. It's about people are smart now. Like reviews are everywhere, and I mean all that means is they go, oh, 5 stars great, but 5 stars 5 star. They go, I'm going to read them, I'm going to understand them. Are they deep? They going deep into what I want as a patient. And I would just encourage people to start thinking a bit more like that, particularly because we all train for a long time. You then do specialist training, and then all this stuff, and like you generally people are experts in 4 or 5 things. Like you tend to get really good at certain things, and also I guess you as a dentist, and correct me if I'm wrong, there's certain types of patients you want to see. They're patients you don't want to see, patients you want to see, and it really helps if you can then start positioning yourself as an expert in something. You'll start to see the patients you actually want to see. And that's going to provide better care because you're seeing patients you enjoy seeing, you want to see, you can help them because you're an expert in that field. So I think there's so much potential. So reviews is one thing, but I think there's a lot more you can do with it. And I guess that's why I want to open people's minds to, yes, it starts with just making sure I look good online, but there's a lot more you can do with it.
Well said. It's about the quality of the review, and it's about establishing yourself in that niche, whichever niche you're in, and really giving that social proof for that niche.
Yeah.
The power of a good review, not just I had a good treatment, everything was clean, that's it. You actually want to come in and say, oh, like I had one recently, I came in to see Jazz because I've been suffering with TMD for years. He spent his time, he listened to me, he adjusted discipline, and now my headaches are gone. That's the kind of review you want, and I totally get your point, and I think I'm so glad you raised that.
Yeah, and it's exactly, and you almost want another patient who has that same problem now, let's say, like who can then find that review really easily, go like, finally, I found a dentist who has actually got experience in treating this, has got results showing that good results. Great, I'm going to go see them. So I think it's there's a lot you can do with it. And for your associates, get in touch with us. I will bring transparency to the dental market. I'm super passionate about it. We've done it in medicine. So like we want to work with people. So if there are people who are a bit skeptical, a bit unsure on how they do it, or they're associates, so they're not sure how to kind of navigate the politics of the industry, where there's always things we can do and help. And I'm really open, like in terms of we can help the practice. Like even in your studio, I'm more than happy to set up your principal in the practice, make them feel good. Like, you're collecting reviews. Let's help them do it the same process. Like there's lots we can do. So I would, I think Alex, who's our head of dental, has got a special treat for anyone who I think quotes this podcast and gets in touch with them, and he's going to look after them. He's going to help them through the journey. Yeah,
he's been very good in the past. He helped sponsor one of my conferences, Occlusion 2020 with Michael Milkers, and I believe I need to get an update for this, but I believe is 50% off for the first 4 months. But don't quote me on that just yet. I'll do it in the intro and outro. I'll
cover it. Yeah, well, it's fine. But if they get in touch, we can do for us. Honestly, we're a subscription business, so it's our goal is to work with as many dentists across the country. We're not like exclusive. Healthcare is healthcare. So we'll help whoever, we'll work with whoever. So I'm really, really keen to engage people, whatever level of experience, whatever stage they are in their training.
Amazing. Suman, thank you so much for coming on today and giving time up in your very busy schedule to come and join us today. Thank you so much.
Thanks, Jazz. Nice talking to you. Take care.
Hope you enjoyed that group function with Dr. Suman, everyone, and I'll catch you in the next episode. Let me know what kind of topics you want. I'm always happy to answer and make these group functions. You know where it's at. It's at Protrusive Dental on the Instagram page. Thank you so much for watching or listening all the way to the end.